Okay. So with that, thank you very much for joining us today for the third session of the root cause analysis series. If you missed the first two, they are available at our Bi-State Primary Care Association website. I'm happy to give out that link after. And today we're going to be talking about how to prioritize those root causes that you've identified and how to turn those into action steps and then sustaining change as well. This morning, the two main presenters will be myself, Kristen Bigelow-Talbert, the Community Health Quality Manager at Bi-State Primary Care Association, and Brittany Dallin from the Minnesota Association of Community Health Centers. She is the Quality Improvement Director there. Joan Talk also assisted in the creation of this series, and she is on the line as well. The learning objectives for today are really to understand what HRSA is looking for the 3 action steps that are required for SQHCs as part of the performance analysis piece of their site visits. We're also going to be talking about how to create and use prioritization matrices for both prioritizing your root causes and also solutions. We're also going to discuss how to develop the action items based on these solutions and then sustain the change throughout. So I'm going to turn it over to Brittany now to talk about what HRSA is actually expecting for these action steps.
Great, thank you so much, Kristen. So I'm just going to briefly give you a little bit of background on HRSA's action step requirements. So as many of you are already aware, as part of the operational site visit, your clinical reviewer will be facilitating a root cause analysis based on your UDS measure. Keep in mind that this focus can change in the future. It could be hypertension, could be childhood obesity, but know that the performance analysis piece will remain forever as far as we know. During this session, your team will be required to talk about contributing and restricting factors that are impacting your diabetes measure. And additionally, you'll have to come up with 3 action steps that you'll commit to working on over the next 12 months. You're going to have to develop a work plan. Either you or your project officer will be entering this into the EHB. We've heard from health centers that sometimes your project officer just enters it and it's all good to go, and sometimes they get a message a couple months later in their EHB that they missed somewhere along the way that's asking them to enter a work plan. So definitely check with your project officer around the expectations for that, because it's something that sounds like can be missed. I know the EHB isn't always the most user-friendly, so it's not hard to miss things in there, but this one particularly gets buried, it sounds like, so keep that in mind. Let's see. You'll need to submit quarterly updates, so your project officer will be checking in with you. I'm not exactly sure what that's going to look like, if it's a phone call, if it's a submission in the EHB. Because this is so new, we haven't had anybody do that quite yet, but we'll keep you in the loop when we find out more about that, and I'm sure your project officer can give you some information on that. And lastly, your action steps can change over time. So you will be required to come up with action steps before your site surveyor leaves. However, you can change them over time, I found out. It has to be approved by your project officer, but if you find that something you've developed during your project or during your performance analysis doesn't make a lot of sense, you can change it in the future. Next slide, please. This is a screenshot of the site visit protocol that outlines the expectations related to your performance analysis. So your site surveyor will need to fill in this field as part of their final report. So like I said, you're going to want to provide your action steps before they leave. And again, I highly recommend meeting with your team ahead of time, performing a root cause analysis and identifying potential action steps. As we all know, when you get a group of people together who are brainstorming for the first time, you may land on some action steps that aren't all that well thought out and or don't make a lot of sense for your current priorities. So you're definitely going to want to be able to steer that conversation. Next slide, please. So following are action steps examples from health centers who have recently gone through their site visits in Minnesota. You'll see that there's SMART goals. They're specific, measurable, achievable, relevant, and time-bound. Kristen's going to talk a little bit more about that later on. For example, increase the number of diabetes patients by X% who receive group visit services, identify X amount of patients with advanced periodontal disease and successfully refer them to medical for diabetes screening visits. By a certain date, 10% of patients who have a diabetes diagnosis will be seen by integrated behavioral health. So you'll see that they're not the generic improve EDS diabetes measures by X%. They're more granular and provide more of the how in improving diabetes care. So with that, I will turn it back over to Kristen.
Thanks, Brittany. So how do you actually get to the point of developing these action steps? There's actually a few different things that need to happen before you can dive in easily to these action steps. So part of that is determining what root causes really rise to the top for the things that you want to tackle, and then identifying solutions to those and figuring out which ones you want to act on. So there's a whole sequence of events that need to happen, and we're going to cover these steps today. So when examining your root causes, you list out which ones you've identified with the original problem statement so you can tie the two together. That's really important. But look at them. Do you notice any patterns or themes that are emerging from these? Do you notice that you could put some into different categories or groupings? And which ones feel plausible to you to be able to actually address? And which ones feel a bit outside of your ability to change? In a moment, I'm going to show you how to prioritize the root causes to narrow down which ones to focus on. So looking at your list of root causes, ask yourself first, if we address this, would it have a big impact on our problem statement? And again, this is why you want to have the problem statement and the root cause kind of side by side or linked together so that you have that easy reference point. Highlight those that you determine that would have a big impact, even if at this time they seem out of your control to change. And you may ask, well, why would I want to do that? And the reason is because during the brainstorm process for solutions, you'd be really surprised at some of the ingenuity of some folks, of their ideas that can be used to solve problems that were previously considered untouchable or out of your reach. So one tool you can use to kind of sort out which root causes to focus on is called the prioritization matrix. There are many different versions out there. If you Google this, you will find so many different ones, and they can seem quite complicated. For the sake of ease of use, I have an example of a simplified version that you can use today if you want to. So this is the simplified template for a priority matrix that you can use. Notice at the top we have an area where you put in the problem statement, again, so that you can link the problem statement to the identified root causes. And remember, there are often many root causes to a single problem statement. So you can list all of those here on the left-hand column. And then the 4 columns after that, there's different areas to focus on that you would rank each root cause based on. In this case, using a scale of 10 to 1, with 10 being a high impact or a high feasibility and 1 being low. And when doing this, feel free to kind of use your team's input, and it's not an exact science. If some individuals are saying it's more like a 7 and others are saying, well, I feel like it's more like an 8, feel free to compromise and put 7.5. This is not something that's really a hard line in the sand. This is the gut feeling of the individuals who are involved in this process. So in this template, how you would go about completing it is you would look at each root cause and then look at each column. So for the impact on the problem statement, this goes back to what I mentioned before. If we were to solve this root cause, would it have a big impact on the problem statement that it's tied to? And then you kind of rank it accordingly. Looking at the feasibility, this is if we were able to get everything together, if we were able to get the partners that we wanted, if we could get the resources that we wanted, would we be able to do something about this? How feasible would it be to act upon this root cause? The third column over is the urgency. So how important is it that we address this right now? Sometimes when it's a matter of patient safety or risk management, it has a higher urgency than it would if it's not as urgent. And then the fourth column is whether or not it's actionable. So while this is related to feasibility, it's more of a question in this case of how likely are you to be able to act on it today or tomorrow? Do you have everything you need in place? Do you have the relationships built with the community stakeholders that might need to be involved? Do you have the tools and resources and capacity to be able to do this today? So for each of those, you would assign a number and then total them up at the end. And the higher the number in the total column, the more feasible and likely it would be that you would be able to actually act on that root cause. So it gets a higher priority. I included a fictional example just so that you can kind of see what it might look like if you put some stuff in here. This is fictional, but I did pull from some root causes that I've done with other federally qualified health centers. So the examples are akin to what you might be seeing as well. So the four that I give for the problem statement of poor diet contributing to several different chronic conditions is really the first one being that folks don't know how to cook the non-processed or raw healthy foods. The second one being that the older population tends to have a higher reliance on providers and doctors to just fix them. The third root cause being a matter of food deserts and the lack of public transportation to get to grocery stores and other places where you might find the healthier foods. And the fourth one being really that grocery stores in this area aren't open 24/7. So for those patients who work multiple shifts at their jobs, they grocery shop either between jobs or right at the end, and the grocery stores might not be open, so the options are limited. For each of these, we assigned a number for the impact, how likely it would be that impacting that root cause would have a positive impact on the problem statement, how feasible it would be to act upon it if we had everything we needed, how urgent the issue was to act upon it, and how actionable it is. Can we do something about it now? And so when we ranked these, we came up with the first root causes really being at the top with a score of 23. So the patients were not brought up to know how to cook healthy or raw and non-processed foods. So that's something that this fictional group felt that they would be able to address. I want to take a moment to really stress that you don't need to kind of do this all on yourself. You don't have to have everything on your shoulders. The way you can really maximize your impact is by collaborating with community partners. And this can be medical professionals. It can also be those that are not medical in nature, like schools, like your transportation companies, the family centers. Think of the folks that are in your community that are working with the public for the public good that you might be able to partner with. Because oftentimes there are several different organizations trying to work on the same issue, but in silos. And the impact they have when doing this is minimal. But when they come together and collaborate, you can maximize your impact while also minimizing the work because you're able to spread it out and really work together. So make sure you work smarter, not harder. Don't have everything on your own shoulders, but think of who you can partner with because collaborations really can have huge and lasting impacts. Okay, so now you have identified those root causes that are at the top. What's next? Brainstorming. And this is actually really where all of the magic comes together. So don't dismiss this step. you can have your most ingenious ideas during a round of brainstorming. Make sure to only work on one root cause at a time, or it can get confusing. So have your root cause on the board, have the problem statement there, and there are a few different ways that you can do this. Some common ones are to have the whole team around the table, everyone who might be involved in this process or the problem statement or the root cause, and have them shout out ideas. Write down all ideas except all of them, no matter how impractical you think they are. So if someone says they want to hire 10 more doctors, great, we'll write that down. This is not the time to criticize or analyze ideas. That will come later. This is really the brainstorming phase. So everything is possible, everything is welcome. So please make sure you open those doors for everyone to shout out their ideas. Another method is to use sticky notes, to have folks write them down on sticky notes. And this can be handy because you can move sticky notes around. So when it gets to the point of prioritizing solutions, it's easy to move them from one spot to another. That's a tool that has been quite handy and is pretty low tech. You can also use a computer if you are projecting your screen onto something that everyone can see. Because if you just have it on a piece of paper in front of you, it can really stifle the process if everyone's not able to see what's been suggested so far and really kind of feed off of that. So remember in this process to revisit your parking lot. Remember in session 2 how I told you before you began your root cause analysis, build a parking lot, because that's where the solutions and ideas during the root cause analysis would be essentially parked. So go back to that now and make sure you're pulling those ideas in. Do they fit with any of the root causes that you've identified as being top priority? Can you use them? Make sure to include them if you can. One thing I also want to note is that very often in larger groups during a brainstorm session, there are some folks who are quieter than others. And these individuals can have great ideas, but they might be intimidated to shout them out during the process, or they may be unsure of their ideas, but whether or not it's really a good idea. I encourage you to talk to those individuals privately where they feel safe and can express their ideas without feeling like the group might be judging them or without feeling that level of intimidation that might otherwise be there. Okay, so next, after you have that whole slew of different solutions for that one root cause, use the same prioritization matrix to be able to determine which ones would be the most feasible to really carry out and kind of go from there. All right, so now you've identified the root causes, you prioritize them so you know which ones rose to the top, you brainstormed your solutions and prioritized those as well, and now you create your action steps, or PDSAs. So PDSA stands for Plan, Do, Study, Act. Many of you may be very familiar with this process, so just bear with me as I explain it for those folks who might not have seen this before. So Plan, Do, Study, Act is really a quality improvement tool that is used to be able to document a quality improvement process. So you do this all the time without even realizing you're doing a PDSA. So as part of this, the plan phase really takes up a lot of the big bulk work of the forefront. So this involves getting your problem statement, your measures, your baseline, your goals, and creating your action plan. This is a whole bunch of upfront work for this planning phase. Next, you really implement your solution, that's the do phase, and you remeasure, see how things are going. The study phase is really about looking at that data and determining if there are any trends or patterns that you can see. Are things going the way you expected or the way you had hoped? And then based on that analysis, you act. So you decide what tweaks are needed, if any, and then go again through the plan and the doing and the studying. It's a cyclical quality improvement process. So this is really an example of a template that you can use for Plan, Do, Study, Act. It's just one example, but you'll see the different components here. The goal right at the top, what are you trying to accomplish? And also, what are you trying to measure? Notice the numerator and denominator here. We'll talk a little bit more about that momentarily, but it's really important to define these so that you can remeasure in a way that is apples to apples from what you initially measured. Also notice the action plan. This is going to be really key for actual implementation of any action step that you create. Okay, the planning phase. This, again, as I mentioned, is really a lot of upfront work, but it's worth it doing all of this logistical planning ahead of time because it makes the whole process so much easier. So as part of this, again, we have the problem statement. You have the root cause that you identified that's associated with the problem statement and the solution that was decided upon with the team. You also outline what the next steps are. And make sure in this process, again, that you're asking who you can collaborate with, because the more you can spread the load and the more partners you can bring in, the bigger the impact you could have. Think about the resources you need to pull this off and make sure you include that in there. Make sure you identify the measures that are going to tell the story that you want to learn about. And I'm going to talk more about that in just a moment. You also need to kind of identify what your goal is, what you're trying to achieve, and not just the what, but an actual quantitative goal. So a percentage, if you want to go from 10% to 30% or whatever it might be for your particular PDSA. Okay. I want to talk a little bit about how to select your measures because it is so important. Measures always include a numerator, a denominator, and a rate, meaning the percentage. And this is so that you can actually measure in a quantifiable way if you've had a difference. So with that in mind, beware of using generic measures. And by this, I mean the ones that we often use for our UDS reports or for meaningful use. And the reason I say that is because the generic measures may not tell the story that you're trying to learn about. They do tell outcomes that might be related to what you're trying to address, but may not specifically talk about the story that you are trying to tell. So think outside of the box a little bit. What measures would actually directly tell the story of the intervention that you are trying to accomplish? Okay, think about that because it's really important. I also encourage folks to look at your denominator size. So this is the group of folks that are included within this study. So if the denominator size is small, it can cause big fluctuations in your percentages. And so just take it with a grain of salt if your denominator size is small. It doesn't mean you have to dismiss that measure necessarily. You just have to keep that in mind as you look at the percentages. So never look at percentages alone. Always look at the numerator and denominator that's associated with that percentage, because that will tell you a lot of information in itself. And last but not least, make sure you get your baseline data before you implement your strategy. This is required for the action steps for FQHCs, and it's also just good quality improvement, because if you don't get this baseline data, you won't have a quantifiable way of really knowing if you've made a difference over time with this one intervention. I want to take a moment to talk about qualitative data and how to convert it to quantitative data. So sometimes The best information that would tell the story you want to learn about is qualitative in nature. So this means that it's observational based or not structured in a numeric format. And it can be a challenge to convert this into quantitative data that you would need to be able to measure if you're actually making a difference. However, thankfully, there are some tips and tricks you can do to convert this information into a quantitative format. Scales like most valuable to least valuable with a rating of 5, 4, 3, 2, 1 are some of the easiest ways to do that. But also look for numbers where they might be hiding and you may not necessarily expect them to be there. For example, you want your patients to be eating healthier after they go to a nutrition class that you've organized as your intervention. How would you measure that? That seems really qualitative about whether or not somebody's eating healthier. Well, some things you could do are to, for example, keep a food journal of before, during, and after class to track the things that are the most important to you. For example, the number of sugary drinks they consume in a day, or the number of servings of vegetables, because then you have a number associated with it. And you could determine what their rate of intake was before, during, and after class. It would give you that kind of quantitative data that's hiding there if only we know how to look for it. Another one with technology now is think about the apps, the self-management apps that are available to a lot of folks. There's apps, for example, in this case, that would track their food intake and that they could have a group support function that would have that information and could really tie it all together for you. So think about those things a little that are there but might be hiding. And also you really want to try to structure your PDSA with quantitative data ahead of time. It will make your life much easier, I promise you. Trying to go backtrack and convert qualitative data that had been collected into quantitative data can be really tricky. So wherever possible, have quantitative data determined ahead of time. So now I'm going to be talking a little bit about SMART goals. Brittany mentioned this earlier, that it has to be a SMART goal for the action steps of the HRSA performance analysis piece. So I'm just going to explain what that means. So SMART goals are specific, so you are precise about what you're talking about. They're measurable, so again, going back to that quantitative data that I mentioned. They're achievable, so they're realistic. You might be able to pull it off. And in this example, it's also saying that you're not going to have a 0% no-show rate, because, I mean, that's a fabulous goal, but realistically, I don't know any practices that would be able to achieve a 0% no-show rate. So make sure it's actually achievable and realistic. Make sure that the goals are relevant to the action that you're implementing. So you want the goal to tie to what you're doing. Again, it goes back to what I mentioned, being careful not to use generic measures. Same thing here. Be careful not to use generic goals. Be specific and relevant to what you're actually trying to implement. The time-based piece really refers to making sure that you define the time that it's going to take, the time that you are trying to see an improvement by, so that you know whether or not you've met your goal by the time frame that you specified. I'm going to give some examples now of some SMART goals and what they might look like. So the first example, to get patients to stop no-showing. Well, this kind of needs improvement. You have the objective here. You want them to stop no-showing, but we don't know the percentages, we don't know the baseline, we don't know the time frame. So let's try revising this. To reduce no-shows from our baseline of 10% to 8%. Okay, well, that's better. You have some data in there, but what time frame are we looking at? So let's try revising it again. Okay, so to reduce no-shows from our weekly baseline of 10% to 8% within 1 month. Okay, so this one is specific, it's measurable, it's time-bound, and it's relevant to what they're trying to do. So this is the best of the three. So try to think about all of the details that you can include in your goal to really make it clear what you're trying to achieve. Okay, now you have your goal, you have your baseline data and your measures figured out. Now you need to actually implement it. So figuring out who's going to do what by when. You develop your action plan. And it's really important in this to assign tasks and to not assume. Because if you assume that Joe's going to do it, and Joe assumes that you're going to do it, it's not going to be done. Because when somebody assumes that somebody else is going to do it, then nobody does it, right? So you want to assign tasks and create a deadline and make sure to hold folks to it. Meet regularly to address this PDSA. Ask them how things are going, what the status is, and if there are barriers to completing their assigned task, what you can do to help them overcome those barriers. Because sometimes things come up, things get in the way, the technology doesn't work, X, Y, or Z other priority came up. So what can you do to help them accomplish what they were assigned in the action plan? This is a sample for a fictional practice of a plan for outreach for mammogram screening. So we have different components here, who it's assigned to. In this case, I just used generic roles, but wherever possible, you really want to be specific about the individuals, again, so that they don't assume somebody else will do it. So in this case, the IT will generate a list of patients who are up to date, and you also see that the resources and tools are included in here. And this can be helpful just to make sure that we have everything in place so that the resources and tools being available is not the barrier to things being completed. And you'll see it goes down the steps, and tracking data and also analyzing progress and next steps are included in this action plan. And those pieces are important because if you don't continue to monitor where you are, how you're doing, how things are going, and what we should do next, it's likely to kind of fall off and be put on the back burner. All right, for the do step, now you have your action plan, you have all the logistics figured out, it's time to get going. So there are a few key things when doing this that can make it more successful. Make sure all staff that are involved in the action plan or that will be affected by the change understand why the change is needed. And just saying that we need to do it for our HRSA action steps is not really as motivating as really talking about the patient need and what you're seeing, what the root cause was, and what you're trying to do to address it. Make sure to get them on board. You know, if folks aren't on board that are going to be carrying out these steps that you want them to be doing, it's not going to be as successful as it would otherwise. Also, make sure staff understand what you want them to do, because with guessing games, it can be really confusing. They just kind of guess and assume what you want them to do, and then you end up with something that's not really what you were hoping for or asking for. Too often I see that with action plans and talking to folks about what they're supposed to do, that it's not clear 100% to the individual who's supposed to be carrying out the task exactly what their supervisor or leader is asking them to do. So make sure that that's really clear. And have a contact person if they do have any questions or concerns. You know, change is scary. It's human resistance human nature to resist change. So make sure to support them and really hear their concerns, and where their concerns are valid and deserve to be heard. So make sure you make that open for them. If you're able to identify a clinical champion for this project, it can help tremendously in moving things forward. Someone who is passionate about the cause. And it doesn't necessarily have to be a clinician. It could be somebody who's really passionate in your practice about this particular cause or root cause and problem statement and addressing it. So if you have somebody who's super excited about this, it will go a long way in the culture of your organization to help move it forward. Also, make sure to check in frequently, because if folks don't hear or see that they're checking in to see how this project is going, it can quickly kind of fall under a pile of other priorities, because we're all working with very full plates, right? So we want to make sure that this doesn't get buried. So check in frequently with folks, see how things are going, and again, if you can assist them with that. Now we get to the study phase. So this is really where you're remeasuring and seeing if things are going the way you expect them to be. It's key to use the apples to apples comparison, so using the exact parameters that you use to get your baseline, with the exception, of course, of the time that you're doing it. So with a baseline, it was before the implementation. The remeasurement is going to be after the implementation of whatever action that you came up with. Also, showing trending data on this Plan, Do, Study, Act template can be really informative to folks about what direction they're going in, if things are going well or not, and if you're getting closer towards your goal. Make sure you assign remeasurement to somebody that they know when it will be done and by whom, so that when you have your regular meetings, you have this information in front of you to be able to really draw on it and talk about it in a meaningful way. Now we get to the ACT piece. So this is really where you figure out how well you're doing. Were you seeing any progress? And if there's no progress, or conversely, a downward slide of where you wanted to go, ask yourself, what effect did our solution have? Did it have the opposite effect? What were the actions that were actually implemented? Was the action plan we decided upon actually carried out? Sometimes a step is missed, and that could be the reason why you're seeing no progress or a downward slide. So investigate that. And if the action plan was carried out in the manner that you had hoped, you might want to do another root cause analysis to kind of figure out what happened. Why would it be that this solution would have this effect? And what could you do differently? More commonly, I see that instances where there's progress, but not quite at the level that they want. So in this case, the action would be figuring out what's working well and what's not. What could be tweaked to get better results? So really kind of doing that analysis when things are improving, but not quite to the degree that you were hoping for. And if you're seeing good progress, that's great. Keep doing what you're doing, but make sure you still remeasure often and you check in with folks. Because again, when that checking in, the meeting about certain projects doesn't happen frequently, it can get dropped and buried under other priorities. So I love this little diagram because it really shows not only that change is scary, and you experience a lot of chaos and resistance as things get changed, because even one little addition to a workflow can throw a team off, because now they have to remember that piece and then they forget it and they have to go back to it, and it's an adjustment. And during this adjustment, expect performance might dip, because that's very common. And as things get kind of settled into the workflow, as it becomes part of their new workflow and processes, you'll see performance come back up. and then it becomes the new status quo and just how things are done. And that's what we're aiming for, but it does take time. Don't expect it to be status quo in a week or even a month, and sometimes not even in a year. There's some research out there that it doesn't become status quo for over 5 years of really doing it and having it as part of the workflows. So make sure that what you're looking for is actually happening on a regular basis. So sustaining change in an organization is a whole nother animal besides just doing quality improvement. And there are some things you can do to actually help this along, to make sure that change is maintained and that it becomes status quo. So some key things to look at is really your leadership, management. Are they in agreement about this project? Do they have buy-in? Are they champions about it? Are they talking about it with folks in a positive way? So whether or not leadership is excited about this PDSA, about this change, can have a big impact on the entire organizational culture and whether or not any other employees take this PDSA seriously. So leadership can have a huge impact. So really getting them on board is key. Additionally, communication is essential. Communicate at all levels of your organization. Without clear and transparent communication, you're opening yourself up to rumors and mistrust and misunderstandings. So make sure that you communicate often about every step in the process. And for those individuals who will be directly impacted by the solution and by this root cause that you've identified, involve them from the start. Get them into that brainstorming process. Hear their concerns, hear their ideas, and make sure to wrap them in. Because the more you involve these individuals, the more likely they will be to buy into the process and actually carry it forward. Additionally, making your results visible to the entire practice is really key, and this is true regardless if it's going in the direction you want it to. You really want folks to see that you're looking at this regularly and that you're thinking about it and that it's at the top of the priority list for the organization. And if you do see success, celebrate it. You can decide what's best for your organizational culture for how to celebrate that, but make sure to celebrate those small successes because it takes a lot of adjusting of workflows, of collecting new data, of doing X, Y, and Z to see that success. So make sure to celebrate it. Let the folks know who were instrumental in creating that success. Let them know that they really were a key component of this and that you appreciate that. And that actually ties into my last point about checking in with staff. How are things going for them? Do they have any questions or concerns, or do they need extra support in one area or another? So if you make sure to really look at these 6 tips and involve them and really incorporate them into your process, you'll have higher rates of success for sustaining this change that you hope to see. And it's important to not give up. Change is hard for individuals, for organizations, and especially if you're going outside of the box. So don't give up. Hang in there, revisit things, look at how things are going, and just keep going. Because you never know when you're just about there to success. It can be so close and you just don't see it yet. So hang in there. You can do it. Okay, so now's the time for questions. We're also going to throw up a poll here for you to fill out. So please do fill it out. It's going to be something that's pretty essential for us going forward to know what's important to you for future trainings. I'd love to have some time here for questions if any of you have any. When asking questions, you can either use the chat function in Zoom or by unmuting your line. And please check both your phone line and in Zoom because you might be muted in 2 different places. So with that in mind, I know I just gave you a whole bunch of information. Does anyone have any questions for us? Okay, so I see one question in the chat. So there's a question about where we can find the first 2 sessions. That will be at our Bi-State Primary Care Association website. So it's www.bistatepca.org. And within that page, if you go to the Community Health Center resources, both recordings are there. We can also provide a link to those folks who did register. I can send out an email with that so that you can get access to it. Are there any other questions? Okay, there's another question in the chat. And the question is, for SQHCs that recently had a site visit, will there be any expectation to start working with a project officer prior to the next visit? That's a fabulous question, June. Thank you. So I'm not aware of any expectation per se. That being said, quality improvement is really coming up as one of the big things that HRSA is looking at and looking for. It's so really kind of behooves your organization to have this as part of just your regular workflow. And Brittany, Joan, and myself would be happy to support any of you in that process. Tracy has the question, would I be willing to share the priority matrix template with folks? And absolutely, I'd be happy to. It's really quite a simple one that's intended to be easy to use and that you could use today. When I send out the link for the previous 2 recordings, I'll be sure to include the Excel spreadsheet with that as well. Oh, so Lowry just put into the chat the link for our that goes to our previous 2 recordings as well. So thank you, Lowry. I appreciate that. So make sure you check out the chat function in Zoom to get that link. Are there any other questions? We have one more question. So in chat, it's, can you recommend any communication strategies for reaching all staff when meetings may not fit into everyone's schedule? And this is something I see actually quite often because getting all the providers in a room or all of the nurses and MAs, it's extremely difficult at times, especially when you have multiple sites. So the different communication strategies I would suggest include figuring out what's already used in your organization. So is email something that everyone looks at? Is your company's internal website communication forum something that's being used? Is there a way that communication goes out regularly to all employees? How, for example, do you reach them when you have important HR information to give folks? How do you get that to everybody? So you can use those forums, and when folks aren't able to come to a meeting, being able to distribute the meeting notes and any accompanying information can still help folks be able to feel like they are included, and also making sure to ask individuals in that email or other communication what their ideas are, what their feedback is, and how they would like to be involved. So there are different ways to do that. It was a great question. Thank you.
Kristen?
Yes, hello.
This is Joan. What I've also seen work pretty well is if you can make it an agenda item on an existing meeting. Like if you have a staff meeting, make sure that this project or QI in general gets, a few minutes on that meeting rather than trying to create yet another meeting, or if you, in addition to the other meetings where there's a work group working on this project, at least at the staff meeting, everyone hears a little bit about it. And the other thing that I've seen to very successful, like you had mentioned earlier about celebrating your success, is, and I know some of our health centers already do this, is put up a big board that shows, describes the project and shows the progress that you're making on the particular quality measure, and put it, some people put it right where the public can see it. Others choose to put it in the staff break room or kitchen or conference room or something like that, and that also helps with the communication and celebration.
Thank you, Joan. That's exactly right. I agree completely. Brittany, did you want to jump in at all before we wrap up?
I don't think so. You did a really great job. Thank you.
Well, thanks. Any other questions while you have the three of us available to you? Okay, well, I want to make sure that folks have a way to contact us. So this is our contact information, all of our email addresses. Feel free to reach out to us with any questions, or if, for example, if you weren't on the original registration for this webinar, but still would like the prioritization matrix or that link again to the previous two recordings, feel free to shoot one of us an email and we can get that to you. All right, well, I appreciate everyone coming on this morning, and I hope you all have a wonderful rest of your day. And we will be wrapping up. Oh, we have one more question. Thank you. Last minute question. All right. So does HRSA accept community-based initiatives as performance analysis change activities? For example, a cooking class in the community to address this first example. The example may not include major changes within the practice or organization. So what I've seen related to this is if the organization is the primary driver of this, then it has been accepted, at least from the reviewers that I've talked to. Again, it's sometimes reviewer dependent, but it's been accepted in the past when the organization has been the main driver of that community-based change. So it wouldn't necessarily have to take place inside of your health center. You could partner with your local church or food bank, for example, to really pull something like this off and still have it count. Again, reviewers may have different opinions about this, so it is something that you could have as a potential action step and talk to your reviewer about that when they come in. All right, thank you everyone. I appreciate your time today and have a great rest of the day.